Hello, I'm Dr. Delaney, and I'd like to talk to you about chin augmentation. Chin augmentation refers to any variety of procedures that helps an individual build up their chin projection, and this is often used to correct an underdeveloped or weak chin. The ideal candidate for chin augmentation has a small or underprojected chin while still having a normal jaw anatomy. Now, if a person has both a small chin and a small jaw, and has an overbite, then in that case, corrective jaw surgery rather than chin augmentation may be the better treatment option. Chin augmentation can oftentimes be combined with other procedures. For example, we commonly perform chin augmentation with rhinoplasty at the same time because the chin augmentation can help us improve the facial proportions when viewed from the side. Chin augmentation can also be very effective in enhancing the outcomes of those undergoing submental liposuction who also happens to have a weak chin. There are three categories of chin augmentation. The first one is soft tissue filler injection, the second one is chin implant augmentation, and the third one is sliding genoplasty. Soft tissue fillers used for chin augmentation are generally comprised of hyaluronic acid fillers and hydroxyapatite fillers. The advantages to using soft tissue fillers for chin augmentation are essentially no downtime, lower cost per treatment, and the augmentation is not permanent. Therefore, you could try out a chin augmentation before committing to something more permanent. Hyaluronic acid fillers can be easily dissolved if you're not pleased with the outcome. Hydroxyapatite fillers are more difficult to dissolve, but generally will reabsorb 2 to 3 years after injection. However, using soft tissue fillers for chin augmentations do have several drawbacks. Firstly, the filler does not provide a discrete three-dimensional shape. Therefore, the injector does not have absolute control over where the filler will eventually rest once injected. Because of this, the final result of the chin augmentation may appear slightly unnatural. Secondly, the fillers are not permanent. With that in mind, to maintain the same amount of chin augmentation, repeated treatments may be necessary. Over time, the cost of such repeated injections may actually surpass that of a one-time surgical permanent chin augmentation. Chin implant augmentation involves the placement of an anatomically correct three-dimensional medical-grade silicone implant through an incision placed either behind the lower lip or under the chin. Now, the benefits of chin implant augmentation include its permanency, its delivery of a high volume of anatomically correct chin augmentation, and the ease with which we can safely remove the implant if so desired. Now, the drawbacks to chin implant augmentation involve the need for a small incision to place the implants, the potential risk for implant malposition or migration, and the short downtime associated with recovery from the procedure. A sliding genoplasty is a procedure by which a controlled bony cut is placed through the chin bone. This frees up the chin bone so it can be repositioned in the desired projection, and then it is secured using plates and screws. This is usually performed through an incision placed behind the lower lip. There are several advantages to a sliding genoplasty. Much like the chin implant, the results are permanent. Now, unlike the chin implant, with sliding genoplasty, you can alter the angle of the chin as well, in addition to adjusting the projection. Now, furthermore, because screws are used in securing the plates, there's also a lower risk of implant migration compared to using a chin implant. With sliding genoplasty, there are also several drawbacks. Because the surgery is more involved and involves bony cuts, there's usually a little bit higher risk of complications such as nerve injury or issues with bone healing compared to placing a chin implant. The recovery is generally also a little bit longer as well. Now, when it comes to reversing a sliding genoplasty, is also much more difficult. And the reason for that is because bony cuts have been made and the bone heals in the new altered position, and you must also address the plates and the screws when performing a revision. My personal preference for chin augmentation is to use soft tissue fillers for those who are not 100% sure they want chin augmentation and would like to try out a new look, and chin implant augmentation for those who are ready for a more permanent change. When considering chin augmentation, important factors for me include safety, effectiveness, and reversibility of the treatment, and I believe soft tissue fillers and chin implants meet these essential criteria. I hope you found this video informative, and we look forward to seeing you at Facial Plastic Surgery Associates.